Thank you, MC. The Honorable Speaker of the National Parliament, the Honorable Deputy Prime Minister, the Honorable Minister of Health and Medical Services, the former Prime Minister and now Minister of Finance and Treasury, Honorable Sugavare, Honorable Ministers of the Crown, of course I do recognize the Leader of Opposition as well, and other members of Parliament, Your Excellency, Ambassador Kai Weiming, the Ambassador of the People's Republic of China to Solomon Islands, and members of your staff, heads of diplomatic missions and members of the diplomatic corps, and also our development partner representatives, the Permanent Secretary of Health, the Chief Executive Officer of the National Referral Hospital, Senior Executive Team, Management Team of the Ministry of Health, the Medical Superintendent, and all staff and officials of the Ministry of Health and the National Referral Hospital, representatives of SICA and SIFGA, the traditional landowners of the land upon which we stand, senior government officials, members of the media, invited guests, ladies and gentlemen, all protocols observed. Good morning. Good morning to you all, and thank you so much for joining me, the Minister of Health and Medical Services, and His Excellency, Ambassador Kai Weiming, this morning to witness and celebrate this historic event. I thank our pastor for the wonderful prayer to invoke God's mighty presence in our handover ceremony of this magnificent facility this morning. Ladies and gentlemen, 13 months ago, we gathered at this very place to witness the groundbreaking and commencement of the construction of this impressive building. Today, we make history to participate in and to witness the official handing over ceremony of this new 4-story comprehensive medical center, which is the first of its kind in our country and perhaps in our region. Your Excellency, Ambassador Kai Weiming, this fabulous facility is a perfect New Year's gift by your government and your country to the people of Solomon Islands as you start celebrating the Chinese New Year. Thank you, Thomas. Ladies and gentlemen, the ceremony this morning marks another major achievement in our relationship with the government and people of the People's Republic of China. It also signifies the deepening of our cooperation in our health sector, in addition to other areas of development in our country. This magnificent gift is therefore a testament of the deepening friendship and cooperation between our two countries. Ladies and gentlemen, this beautiful building is one of many developments in the Ministry of Health and Medical Services, resulting from the Memorandum of Understanding that was signed between our two countries in 2021. Many of these have been delivered by the People's Republic of China on our behalf. At an estimated cost of approximately 90 million Solomon dollars, as we have heard earlier, this new state-of-the-art comprehensive medical center that we are celebrating its completion and official handover today will lift the range and quality of medical services available to many Solomon Islanders without the need for referral to overseas institutions for investigations and further treatment. Ladies and gentlemen, the major services that will be provided at these new facilities are cardiology, which deals with the heart and heart diseases, nephrology, which deals with kidney diseases, and urology, which deals with the disease of the urinary tract, including those related to the kidneys. The facility has specialist clinics in the three disease categories: traditional Chinese medicine clinic and a pharmacy on the ground floor, 3 wards of 8 beds each on the second floor for each of the 3 disease categories, together with a 2-bed hemodialysis unit, a laboratory, CT scan, conference center and training room on the 3rd floor, and operating theaters on the 4th floor. We now have world-class facilities for these 3 disease groups to undertake most of the diagnosis and treatment. We will now focus on enhancing the capacity of our doctors, nurses, and other related specialist disciplines to enable the facility to provide the fullest level of service possible to our people as soon as possible. Ladies and gentlemen, as stated above, this new center now offers a strategic platform to provide comprehensive and integrated quality healthcare services for patients with heart disease, kidney disease, prostatic disease, bladder disease, and diseases of the ureters and urethra. It will also provide highly specialized interventions for non-communicable diseases, NCDs, as we have heard from the Minister of Health earlier. The center will also provide specialized services in Chinese traditional medicine and acupuncture. The advanced medical technology offered in this new facility, together with the continuation of the Chinese medical team on the ground, will ensure specialist skills, knowledge, and technological innovation are harnessed to foster high-quality services through the strengthening of staff professionalism and focus on greater patient satisfaction. This facility heralds a new beginning that will contribute to more efficient provision of integrated health services aimed at enhancing early diagnosis and treatment, which will minimize frequent occurrences of complications of heart attacks, renal failure, and urinary tract complications. The inclusion of Chinese traditional medicine and acupuncture in this new facility provides alternative sources of effective, safe, and culturally acceptable medical practice. The Ministry of Health and Medical Services and the National Referral Hospital had been closely monitoring the benefits of traditional Chinese medicine, including acupuncture for alternative treatment. The findings have been very encouraging. It is a cost-effective method of treatment. Ladies and gentlemen, the health cooperation between Solomon Islands and China that was formalized in 2021 opened the way for the supply of substantial amount of NCD-related medications, more than SBD $2 million support towards provincial outreach, and the establishment of an isolation facility at the National Referral Hospital for patients. Topping this had been the annual deployment of the Chinese medical team, CMT, with the current third cohort of the CMT almost completing its tenure and will be replaced by the 4th cohort, which is expected to arrive soon. However, unlike the current annual deployment, the 4th Chinese medical team will be deployed for a duration of 3 years. This will allow continuity of capacity development and capability enhancement at the new comprehensive medical center. The first 3 cohorts of Chinese medical teams have been extremely committed, highly professional, and demonstrated excellent work ethics. They delivered exceptionally high standards of clinical services to our people in several disciplines, and also built the capacity and capabilities of our local doctors and specialists in their respective fields of expertise. Can we give them a round of applause, please? At this juncture, ladies and gentlemen, let me convey my most sincere gratitude to the Chinese medical teams that have and are currently helping us, and also to thank Guizhou Province, the Guizhou Hospital, and the government of the People's Republic of China for enabling the deployment of the 3 medical teams to Solomon Islands. My government, through the Ministry of Health and Medical Services, looks forward to welcoming the 4th medical team to our shores soon. I would also like to pay tribute and thank His Excellency Ambassador Kai Wei-ming and his staff in helping to open another relationship with the Nafang Hospital in Guangzhou in the field of oncology. Can we give them a round of applause? This is a very important area of need in the Solomon Islands, and we hope that the relationship that is now developing between the Nafang Hospital and the NRH oncology units will continue to grow in time. The Ministry of Health and the National Referral Hospital Management will work with the 4th medical team to enhance the administration, management, and overall governance of the new comprehensive medical center. Ladies and gentlemen, one of the major beneficiaries from this new facility will be people suffering, as we have heard from NCDs, or commonly known as, or diseases, non-communicable diseases. NCDs affect hearts and kidneys. They affect our brains. They can destroy our nervous systems and our eyesight. NCDs, which are driven by main 6 factors, namely increased sugar, increased salt, increased fats in our diets, smoking, alcohol, and lack of physical activities, is now the single largest killer of people in Solomon Islands. And as the Minister of Health mentioned earlier on, accounting for 7 out of every 10 deaths. About 60% of all admissions to the medical wards suffer from diabetes, and 40% from hypertension. Heart diseases in men has increased from about 60% of admissions in 2018 to 65% in 2020. And in women, it was 35 to 45%. During this period, 583 patients were admitted with heart diseases each year. The costs of NCDs in the country and their impacts burdens the health sector. In addition, the loss of productivity at the workplace or in families, loss of human lives, and the loss of human dignity are immense and substantial. Relating to the burden on the health sector, the healthcare costs of NCDs are substantial. Diabetes alone account for 20% of the Ministry of Health and Medical Services budget. The average cost for one NCD admission is between $18,238 and $26,465. To give us an idea of the NCD cost per condition per patient, allow me to provide you a snapshot. The cost of cardiovascular disease, heart disease, per patient is estimated to be $82,000. The cost of amputation per patient is $58,300, while cost for foot ulcer is $20,000. To provide increased capacity for this new facility to operate effectively, my government has increased the 2025 budget allocation for procurement of drugs and supplies by SBD $70,375,000 to a total budget of SBD $127,346,000 $573 for 2025. This budget will ensure we will no longer run out of medicines in Solomon Islands once we have made all the procurements this year. Ladies and gentlemen, Solomon Islands is in an NCD crisis right now. Our health system has been struggling under the weight of NCDs in addition to coping with ongoing communicable diseases. This new comprehensive medical center will provide the added space, modern medical devices and technology, and new specialist knowledge and skills in treating, secondary prevention, and preventing of severe morbidity and mortality of all NCDs. In addition to lifting the level of care in our clinical services, the Comprehensive Health Center will also help the ministry mount programs to address the 6 key drivers of NCDs: smoking, alcohol, sugar, salt, fats, and the lack of physical activity. These drivers lead to diseases such as diabetes, heart disease, hypertension, stroke, kidney disease, liver disease, and lung diseases. It is a known fact that smoking is the leading cause of lung cancers and chronic lung diseases. It is also a known fact that excessive alcohol drinking is a leading cause of liver cancers and chronic liver diseases. This state-of-the-art new hospital will enhance NCD treatment and management, as well as increasing our capacity to develop comprehensive plans to address the key drivers of NCDs. My government will step up actions to reduce tobacco consumption under the Solomon Islands Tobacco Control Act 2010 by restricting smoking in indoor places and on public transport. We will also upgrade guidelines on advertisement and promotions, and packaging and labeling requirements. We will explore and revisit the licenses on manufacturing and distribution companies and wholesale and retail outlets. We will increase the charges as may be necessary as the cost and health impact of tobacco smoking far outweigh the benefits gained from the current license fees collected under the Tobacco Act. Ladies and gentlemen, this new comprehensive medical center will herald a new phase in the development and improvement of the National Referral Hospital. We want to visualize the National Referral Hospital as a continually improving hospital that aims to become an accredited tertiary care standard hospital with an effective and reliable clinical care service and governance system in place. This new hospital has delivered the first phase of the National Referral Hospital business case, which is to improve these services of the current National Referral Hospital. Ladies and gentlemen, before I close, allow me to convey my gratitude and sincerest appreciation to several leaders who have made this new hospital possible. Firstly, to my predecessor, the former Prime Minister and now the Minister of Finance and Treasury, the Honorable Manele Sugabari, who did the groundbreaking ceremony on this very site 13 months ago. I also acknowledge the former Minister of Health and Medical Services, the then Honorable Dr. Calvictor Amara, for his steadfast support in the early phase of this hospital project. Let me also thank the current Minister of Health and Medical Services, Honorable Dr. Paul Bosowai, for ensuring the tempo on the construction did not drop, which has resulted in today's handing over of the new hospital. As we have heard, he's the youngest member of Parliament. And with the Ministry of Health and Medical Services portfolio, I'm sure he will never get old. Let me also thank the Minister of Health, the Ministry of Health's Senior Executive Management Team, led by the Permanent Secretary of Health, Ms. Pauline McNeil. I commend your tireless efforts and your collective vision and foresight right from day one. You did not waste time in ensuring government responsibilities were attended to, enabling the construction work to commence soon after the groundbreaking ceremony 13 months ago. Thank you and congratulations. To Ms. Zheng Manhog, team leader of the Project Management Group, Central South Architectural Design Institute, CISADI, and Sheng Yang, my sincere gratitude for your professional and efficient management of the project. What was supposed to have been a 16-month project has been completed in 13 months. To Mr. Ji Liu Ping, team leader of the Construction Technical Group, Jiangsu Jiangdu Construction Group Company Limited, JJC, your dedication and professional workmanship is seen throughout this building. Under the heat of the sun, humidity, or rain, you were steadfast in ensuring that the construction of this wonderful comprehensive medical center continued unabated. Let's give them a round of applause. Further, you have employed over 205 of our local people, giving them the opportunity to learn new trade skills and knowledge, but more importantly, giving them the opportunity to put bread and butter on the table for their families. Thank you so much, Mr. Ji Liu Ping, for your leadership in ensuring that the construction of this splendid building is delivered ahead of schedule by 3 months. Ms. Sheng Manhog and Mr. Ji Liu Ping, together you have set another record in the construction industry in Solomon Islands. You have completed a major 4-story hospital in 13 months. You delivered beyond our expectations. I thank both of you and your respective companies and workers on behalf of the people and government of Solomon Islands. Finally, let me convey my sincerest appreciation to His Excellency, my good friend, Ambassador Kai Wei-ming, and through him, the people and the government of the People's Republic of China for this tremendous and wonderful gift to the people and the government of Solomon Islands. Truly, we cannot expect a better New Year present or gift than this fabulous comprehensive medical center. Because in only a few days, on the 29th January 2025, the people of China all over the world will be celebrating this Chinese New Year, the Springs Festival, a celebration of the beginning of a new year. And this year, as we have heard, is the year of the snake. This new facility is indeed a significant New Year gift from the people and government of the People's Republic of China to the people and government of Solomon Islands. I now have the honor to accept this magnificent gift of a brand new, state-of-the-art, comprehensive medical center with a grateful heart on behalf of the people and government of Solomon Islands, from the people and government of the People's Republic of China. Ladies and gentlemen, let me now close with a quote from the book of Psalms in chapter 118, verse 24. And I quote, "This is the day that the Lord has made. Let us rejoice and be glad in it." End of quote. To God be the glory, great things He has done. We are one nation, we are one people, we are Solomon Islands. May God bless the new comprehensive medical center. May God bless the peoples of the People's Republic of China, and may God bless Solomon Islands from shore to shore. Thank you too much. Shishe.